When people hear the word facelift, very often they immediately think of something artificial. They imagine a face that looks very pulled, tight, frozen. And honestly, I understand that fear. Because for many years, that was the image of facelift surgery. But that image comes mostly from older techniques. Techniques that relied too much on pulling the skin, and that for me is exactly the problem. Because aging is not really a skin problem. The face ages in depth, the tissues get heavier, they descend, the jawline lose definition, jaws appears, the neck becomes less sharp, the folds around the mouth become deeper. So if you only pull on the skin, you are not really treating the real mechanism of facial aging. You are just stretching the surface of the skin, and that is often when result starts to look unnatural. That is why my vision of a facelift is completely different. For me, a facelift should never make someone look numb. It should never make someone look like another person. A good facelift should simply make you look fresher, less tired, less heavy. People should notice that you look good, not that you had surgery. And this is exactly why I like, and it's my passion, the deep lane facelift. Because, in my opinion, it is one of the most refined and most logical techniques in facial rejuvenation. So, why? Because instead of depending mainly on the skin tension, it works on the deeper structures of the face. In a deep lane facelift, I go under the muscular layer of the face, just here, to release and reposition the tissues properly. This is the key. The lift does not come from pulling hard on the skin, it comes from restoring the deeper tissues to a more natural position. And when that is done correctly, the skin can simply be repositioned with very little tension. That is why the result tends to look more natural. And that is why it tends to age better. And that is why we can avoid that all look fashion pulled appearance that so many patients are afraid of. Now, who is a good candidate for a deep lane facelift? Usually these are patients who are bothered by sagging in the lower face and the neck. They may notice some jowls, loss of jawline definition, a heavier lower face. The skin become loose, or there is some laxity in the neck. The nasolabial folds are deeper, and very often what they tell me is not, I want to look different. What they say is, I look tired, I look heavy, I look sad, and I don't look like how I feel. And that, to me, is often the right starting point. In general, this procedure is most often considered from around the age of 40 and beyond, but there is no strict age rule. What matters much more is the anatomy, the quality of the tissues, the degree of aging, and of course the overall health of the patient. A healthy patient in their 60s can be a very good candidate for a facelift, and sometimes a younger patient is not yet ready for a facelift and may need something else instead. Because this is also very important. Not everyone needs a facelift. Some patients mainly have a volume loss or have an issue with the skin quality. Some are bothered by the eyelids more than by the lower face, and some need a combined approach. And that is why a good surgery always starts with a good indication and a good examination. The important thing is not to make everyone fit one procedure. The important thing is to choose the right treatment for the right face. So, what does a deep lane facelift actually improve? It improves the jawline, it lifts the jowls, it refines the transition between the face and the neck, it improves the neck, the overall neck contour, and it softens the nasolabial fold. And in many patients, it also improves the global harmony of the lower face. And what I like about this procedure is that the improvement is structural. It's not just a superficial tightening, it's a true repositioning of the facial tissues Now, of course, a facelift does not do everything. And I always like to be very clear about it. It does not treat every fine wrinkles. It does not replace a skin treatment. It does not automatically correct the upper eyelid or the lower eyelids or even the brows. And it does not stop aging. A facelift is not magic, but when it's well indicated and well performed, it can create a very beautiful, elegant, and long-lasting improvement of the face. Now, let me explain briefly how the surgery is done. So basically, the procedure is performed in the operating room. Most of the time, I do it under general anesthesia. In some selected cases, it can also be performed under local anesthesia with sedation. The surgery usually lasts around 4 hours, and in most cases, patient stays 1 or 2 nights in the hospital afterward for monitoring and comfort. During the surgery, the incisions are placed all around the ears in areas designed to keep the scars as discreet as possible. Then I elevate the skin carefully, and after that, I access the deeper plane by opening the muscle layer. This is where the important part of the surgery happens. I release the deeper attachment that holds the facial tissues in their descended position. And once those structures are released, I can reposition the face much more naturally. Then the skin is repositioned gently without excessive tension, with almost zero tension. And then the excess skin is removed. The final closure is done with very precise and fine sutures. At the end of the procedure, a light compressive garment is applied. Patients also always ask me about the recovery, and recovery is something I like to explain honestly and perfectly clearly. Usually, pain is not the most difficult part. Most patients describe more a feeling of tightness, of pulling tension on the neck, and a lot of hair discomfort. They can feel the hair very sensitive at the beginning, but the face is not really painful. This is in general well controlled with the prescribed medication, basic painkillers. And what really requires patience is swelling. Swelling and bruises are completely normal after this type of procedure. The face can be very swollen during the first days, and especially during the first 7 days. That is normal and it's part of the process. Then, little by little, things start to settle. Bruising can often be camouflaged with makeup after the early period. Patients can usually shower after 48 hours, washing gently and drying the scar area carefully. The scars are generally sealed within 7 to 10 days. Sutures are removed during the follow-up. And then, over the following weeks and months, the scars continue to fade and become more discreet. Exercising usually has to wait about 1 month, 6 weeks, and socially the main thing is to understand that the face needs time. Not because something is wrong, but because tissues need time to settle beautifully. That is something I often repeat. Facelift recovery is not only about healing, it's also about patience. Now, when do you see the result? You can see an improvement quite early. Very early on, you already notice that the jawline looks cleaner, the jowls are improved, and the neck is better defined. But the final result takes time. The face needs to soften, the swelling needs to resolve, and the tissue needs to relax into the final position. So while there is an early visible improvement, the refined result is really appreciated over time. And in general, I would say the final result is best appreciated around 6 months after the procedure. Often there is another important question: how long does it last? A well-performed facelift can last many years, often up to 10 years. And of course, the surgery doesn't stop the aging. You continue to age, but you age from a better starting point. And that is a very important nuance. The goal is not to freeze time, the goal is to reset the clock in a natural way. And for me, that is the true beauty of a good facelift.